Thank you, Dan Wang. Indeed, we are here at Parliament buildings, and it's high expectation here as President Uhuru Kenyatta is expected here from 2:30 to give his State of the Nation address. Key issues expected from the Big Four agenda of the Jubilee government, the issues surrounding the handshake. You remember, since President Uhuru Kenyatta and Raila Amolo Odinga shook hands on the footsteps of Harambee House, the issues that were discussed between the two leaders have been kept secret, with Kenyans left guessing what entailed the meeting between the two leaders in the country. Now I'm joined by Samburu North Member of Parliament, probably to just tell us what he expects from today's State of the Nation address.
Yeah, thank you so much. First of all, I want to congratulate the President for having time to come and address both houses of Parliament here in Nairobi, in our chamber. Of course, this is normal. It's provided in the Constitution, and I think it's doing the right thing. But I think it's more importantly, it has also come at the right time because of the handshake, the unity between the President and the opposition leader, so that it can dispel off the tension, the differences that occurred during the last election. Because that election was really very, very grueling, and also it brought a lot of division in our country. So this particular issue of addressing the nation from Parliament will go along actually to help us to create unity and cohesion. But what I expect myself is I expect him to address the issue of universal health care. That is very critical in this country. Even from areas that I come from, the Samburu North and Samburu County in general, so many Kenyans are unable to access to health care. The hospitals in those parts of the country, the county hospital, the sub-county hospitals, the so-called health facilities are almost grounded. There is nothing. All the patients who have serious ailments, if you are not able to reach Nairobi or Nakuru to access to health care in those other parts of the country, you just die. And of course, majority of them cannot access because they are poor.
Now, when you talk about the handshake, one of the issues that you cannot sweep away or sweep under the carpet is the issue of referendum. It has come out playing openly in the public gallery, with leaders both from Jubilee and the NASA coalition divided over the subject. Do you think it's an issue that the president should express himself on? Because the last time he talked about the issue of referendum, he wasn't very much clear.
Yeah, I think he can address that, but in my view, the issue of referendum and changing the constitution, we have changed the constitution last time, and we thought this was the best constitution we could ever have. Constitution is just a piece of paper, and Kenyans are very well known in making laws, making policies, and then you put in the shelf. This constitution, I thought it should have been the best. However, if it is going to help us to create unity, to create cohesion, why can't it be discussed? But I think the critical issue now is to fight ethnicity and corruption. That is what is in the table at the moment. Even before we talk about the constitution changing, because we have changed the constitution, yet we still have serious divisions, serious tribalism in this country, serious corruption. So even if you change and you don't make it use of it, what is it for? So I expect him to address that. But I think it is not a very urgent matter at the moment. We can do it towards the tail end of this parliament and do whatever we can do, and it should go to but the issue of corruption, healthcare, ethnicity, infrastructure, security is what is at our hands now.
Now, when you talk about the State of the Nation address, it's not the first time President Uhuru Kenyatta, actually it's the first time during his second term, but it's not the first time he will be addressing Parliament. Quite a number of Kenyans feel that mostly it has remained like it's not. It's just ceremonial. It hasn't. The president hasn't outlined exactly what he wants to do to address some of the issues that affecting the people on the ground.
There's a time he addressed this house again. I think about 3-4 years ago, and he was given an applause. People stood up because he talked about corruption. But to our surprise, the list he was given by EACC did not yield any fruits. We went back to the same scenario. I think they misled him. So people were sacked. People were about 5 cabinet secretaries were removed from the offices. Yet there was no clear evidence on the evidence on the corruption. They are still there. They are innocent. They were innocent. So if he comes and addresses and he puts something forward, it must be implemented fully, and we must have enough background, enough information on what solution we want to give to that particular issue. Okay. And of course on the issue of security, I would rather he addresses security, because Kenyans we are still lagging behind in terms of security, particularly for the issue of cattle rustling. In my county, in my sub-county, in my constituency, we have very many poor families which are forced because of the stealing, because of people who have firearms, who are very powerful. They take all the animals of people, of the local people, and yet the government is unable to recover those animals. We would rather then compensate those people of ours, because they are very poor. Particularly a place called Suyan, we still have people who are 24 families who are now rendered poor, begging, totally begging now, and their young ones are being killed. But I want to revisit the issue of healthcare. Healthcare in this country is really cancer, especially cancer. Renal problem, the kidney diseases, rather those terminal diseases, we are not able to address and give Kenyans medical cover, because they are poor, they are unable to pay. Like for example, in Samburu, we cannot critically diagnose the disease until you come to Nairobi, to Kenyatta. Kenyatta is already congested. Kenyatta, because of the strike of doctors, there's no professional healthcare in Kenyatta. Unless you go to private hospital, you cannot be treated well. And if you don't have money, only few can go to private healthcare. So he needs to address that. Then the issue of unemployment. In every single county, young men are just seated idle. There's no employment at all. So we need to do something about the employment of youth in this country, to make sure that at least we reduce unemployment, because it is really a big problem that can occur if we have a big population of young men who are qualified and are unable to get jobs. Yeah.
Thank you, Mheshimiwa. That is the Member of Parliament for Samburu North, Honorable Olento Imanga, who has just talked about several issues that he expects the president to address, especially at this time where the country is grappling with several issues, and especially Kenyans complaining about the high living standards. They say that actually, or he says that some of the issues that he expects the president to talk about is about security, number one. He puts security as number one, and universal health care, which he says that when you look at his constituency, when you look at the county of Samburu, there are several issues when we talk about matters health.